Well, President Biden's Build Back Better Act now in the hands of the U.S. Senate after it passed in the House Friday.
Senate Democrat leaders are hoping to pass the $1.7 trillion package before Christmas. And if they're able to, News 5's John Kosik tells us it could be a big win for Cleveland hospitals.
If it were to pass, the $1.7 trillion Build Back Better Act would be the biggest expansion of America's social safety net in 50 years. Congressman Tim Ryan says providing more care by covering more services would also be a shot in the arm for Cleveland's largest employers, the healthcare industry.
It's money that will help all the healthcare providers in the region, and that means jobs and growth and development, and nobody knows that better than Cleveland.
Cleveland knows it because they've lived it over the last decade following the passing of the Affordable Care Act and the state's expansion of Medicaid in 2013. Then Governor John Kasich issued this warning at the time to those in his own party that were attempting to block him from adding 700,000 Ohioans to the rolls of the insured.
You want to create chaos? Don't pass this and see what happens to the Cleveland Clinic and University Hospital up there in Cleveland. It will be a very bad impact on them.
Well, it was passed, and the impact in turn, not bad but good. Since 2014, the Cleveland Clinic has become the state's largest employer, watching its total number of employees grow by 11,600 or 28%, University Hospitals growing by 58%, and even Metro Health, which a decade ago was laying off workers to balance the books because of growing levels of uncompensated care, they've grown by 39%. And are just a year away from the opening of their new hospital, a building that will provide many of those increased services under the act.
It means jobs, it means development. You watch what Metro is going to do over the next few years. It's going to take down buildings, green space, more jobs.
And they are not alone. There are 245 hospitals in the state, with most seeing growth since 2013.
All of a sudden, we had a huge shift of uninsured going into the insured and having access to healthcare coverage and becoming beneficiaries of the Medicaid program.
In Cleveland, John Kosik, News 5.